Hey there, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to this series of Integrative Movement Insider, where we're discussing the concepts of what our older clients need from their programming. If you work with the older population like we do here in our clinic, then you understand that our clients have very specific goals, right? They want to do certain things. They want to do the things they need to, want to, and love to do. However, when we do our assessment, we also figure out the things that our clients need. One of those things that our clients really need that we'll discuss in this video is our clients need better balance and gait. Because many of our clients, especially our older clients, will experience issues with walking because they don't have great balance. And they'll also have issues with walking, which also relates to balance, because they don't have great dissociation. And here's what I mean by dissociation. They're not able to move their rib cage and spine, thoracic spine, independent of their lumbar spine and pelvis. So therefore, when they go to step forward, for example, they move as a chunk or a unit. So rather than stepping forward with the left leg, for example, and being able to counter-rotate their trunk and spine the opposite direction, they actually move as a chunk, and that way their gait and their balance are compromised. It becomes very inefficient. And that also relates to increased likelihood of falling, because the ability to change your center of mass and adjust your center of mass to any perturbation or movement of your body requires the ability to move your rib cage and spine, thoracic spine, independent of your pelvis and lower extremity. So here's a very simple and easy progression we use with our clients to teach them thoracic dissociation from their pelvis and lumbar spine, as well as from their head and neck, because oftentimes they don't have great dissociation or ability to move their rib cage independent of their head and neck. And that's why when they look left, for example, their whole body will then come left with them, and therefore they have a likelihood of going over quite frequently, and it also affects their gait. So here's the pattern. We put them into a split stance, and oftentimes we can start by giving our clients support if they need support, if they have trouble with the split stance position, because we want to make sure our clients have the ability to be stable and they're not like this, because that is just a compromised or compensated strategy. So we go split stance first, and then either hands on the wall lightly or upon some kind of support, and or hands off. I'll often have them put their hands upon their own rib cage, because I want them to be able to feel when their rib cage is moving independent of their pelvis. So hands go on the rib cage, they'll take a deep breath in, my left leg is forward in this position, and now I'm going to have them rotate towards the forward leg and then come back. So they'll breathe in here and then breathe out as they rotate towards the forward leg. Their pelvis should stay moving or stay facing straight forward as their rib cage moves towards their forward leg. Because ultimately, when we go through the gait cycle, as your left leg comes forward, the right side of your rib cage, or your rib cage, should be rotating, counter-rotating towards that forward leg. So breathing in, and then breathing out, and then rotate towards that forward leg. And of course, switch sides, same thing, long spine position, rib cage stacked over top of the pelvis, and then counter-rotate your rib cage towards the forward leg. And they only move as far as they can, where they can keep the head looking straight forward and no motion in the pelvis and or lower extremity. So that way we're teaching them to dissociate the rib cage and the thoracic spine from the rest of the pelvis and lumbar spine, as well as from their head and neck. Very simple, very effective strategy for teaching dissociation that they need ultimately for gait and ultimately for balance. A progression from this is you just have your client take a step forward and then rotate the trunk towards, again, keeping their head looking forward, keeping their pelvis facing forward as well, and then come back. Step forward, rotate, and then come back. Step forward, rotate, keep the head looking forward, step forward, rotate, and come back the whole time. Long spine, rib cage stays stacked over top of the pelvis, because we want to respect the principles of the integrative movement system: alignment, breathing, and control. So it's a great way, simple strategy, simple pattern to improve balance and ultimately gait, and create a better strategy for posture and movement in your clients, and incorporate many of the corrective exercise strategies we use with our clients, alignment, breathing, and control, into their fundamental movement patterns and progressions to help them do the things they need to, want to, and ultimately love to do. So this is Dr. Evan Osar with Integrative Movement Insider, sharing with you some of the strategies we use with our own older clients. In the next video, we'll keep with this theme of giving your clients the things they need so that they can do the things they need to, want to, and love to do. Thanks for watching. We'll catch you next time.